This simulated video resource is to support trained after-action review facilitators in their role. By watching the video, you will learn about how to use effective facilitation skills to handle difficult situations that may arise in the AAR meeting.
Dr. Matt Sullivan, I'm the emergency medicine consultant.
Yes.
I call the AAR, yeah.
Okay.
Let me introduce you to Eva from the ambulance, and this is James here. He's from the care home.
Thank you very much.
I'm, as I said to you, I'm from the from the emergency department
Yes,
consultant.
yes,
I call the AAR because of the incident that happened with Angela Farrell.
Matt,
where
would you like to take a seat and we'll go through all of that now in a minute.
I will.
Thank you very much indeed for your help.
It was a misdiagnosis.
Yeah, okay, thank you.
Yeah, okay, yes,
Thanks very much. Hi everybody. Thank you so much for coming. My name is Laura Byrne and I'm here to facilitate this after action review. I'm the senior social worker in Newtown University Hospital, and you're all very welcome here today. So could I continue with the introductions? Eva, can you tell me about yourself?
I'm Eva Smith and I'm the advanced paramedic.
Thank you very much. And
hi, I'm James Ibarra. I am the Assistant Director of Nursing for the Sycamore Lane Care Home.
Thank you, James. And Matt.
I'm Dr. Matt Sullivan. I'm the emergency medicine consultant here in the hospital here. I call the AAR because of the incident with Angela Farrell, the misdiagnosis of the fracture.
Okay, thank you.
We weren't given the information that we were supposed to have in order to...
thank you very much. And just, could I ask you all, is it all right if we go by first names?
Yep,
is that all right? And that we could leave the hierarchy outside the door for this occasion. Thank you.
Okay.
Everybody agreeable with that?
Yep.
Sure, yes. Laura, how are you? I'm in the right room anyway. Dr. Matt Sullivan, I'm the emergency medicine consultant.
Yes, of course. Yeah.
I just wanted to give you a heads up on this session. I mean, I can tell you exactly what happened in the background.
Sorry, Matt. No, I'm going to have to... Sorry, can I stop you there, please? This meeting starts at 2 o'clock. And I can't discuss it until everybody's here together, but we'll be really happy to hear your point of view once we start at 2 o'clock. It's only a few minutes now to wait. Before you know it, everybody be here and then we can start. Okay? Thank you very much. Thanks for being on time.
Okay.
James, would you like to introduce yourself to everybody?
Hi, James. I'm sorry, Laura. I'm just making sure, do I need to be here for this? Like, it couldn't have been done over email or anything like that. Like, I don't have the time. I'm short-staffed, or I have residents to look after. It couldn't have been email, no?
I really appreciate how busy you are. I understand that, and I understand how busy everybody is. And I appreciate everybody giving up their time to actually have this discussion about what happened. I don't think we could actually do it over email. There's something about being in the room and hearing what you have to say and hearing your perspective on what happened. And I think we would really value that and learn from that as well. So if it's okay with you, it won't take very long. We should be finished in about a half an hour or so, and we'll get through it as quickly as we can.
Okay, and also I just want to make sure this isn't like a public report. It's not going to reflect back on Sycamore.
Oh, absolutely not.
Okay.
No, there will be a very short document which will be circulated to each of us, and you'll be free to comment on that, but it will be anonymized. There's nobody's name going to be in that, and it's certainly not a judgment on you or on any individual here today or on the care home. It's simply a matter of finding out what happened and learning from that. The first question we have is, what did we expect to happen?
Laura, I can tell you all about that. I mean, like, you know, I've been talking, I'm blue in the face talking to hospital management about planning and the lack thereof. I mean, you know, I've been asking them to extend radiology hours for I don't know how long now.
Matt, can I just stop you there, please, for a moment? I hear what you're saying, but we're not here to discuss that today. We're here specifically...
Well, it's part of the problem. You're saying, what did you expect to happen? I mean,
no, but we're here specifically to discuss Angela's care. Angela Farrell's care. So that's the purpose.
Angela's case is a prime example of the radiology department closing down too early, and I've said it to the hospital management so many times that we need to extend those hours into the weekend period.
If we could just focus on the specifics of Angela's care. I understand what you're saying, I hear what you're saying, that has an element of it, but really the purpose of this AAR is to discuss and to focus on Angela's care. So we're going to begin with the first question. What did we expect to happen? Eva, can I go to you first? What did you expect to happen?
I I suppose I would have just expected that the patient would be looked after in the emergency department.
Yeah. I also expected the patient to be taken care of.
Sorry, James. I don't think Eva's quite finished yet. Could we just hold that thought, and I will be back to you. Eva,
Well,
can you expand on that? Sorry.
I can always tell you what I expected.
No, Matt, I don't think Eva's quite finished, so thank you. Eva.
Thanks. Yeah, well, normally the patient would be accompanied in a case like
That's
this
true.
in the emergency department, so that's what we would normally do. That's what I would have expected, and they'd have a really thorough handover letter as well. So, yeah, I guess those would be two things I would have expected.
We're on question 2. What actually happened? So, Eva, can I ask you to tell us what actually happened from your perspective?
Yeah, well, I brought the patient into the emergency department and I gave a verbal handover. I was really surprised to hear actually that she was given medicines she was allergic to. That's very surprising to me, given that I did give her a handover and I gave a referral letter from the care home as well. So I'm really surprised that happened actually.
Okay, so just to be clear, with regard to the medications, the allergy, do you remember if you discussed that with the emergency department doctors?
I mean, I definitely told them that I was worried about her hip, and I definitely told them that she had early onset dementia and that she'd been brought from the care home. I definitely mentioned that she was on her own. Sure. I would have assumed that would have been in the letter, to be honest.
Sure, yeah. But you don't recall if you actually verbally mentioned it or flagged it with whoever you handed her over to?
I don't think it was a part of my verbal handover, no. Specifically about the medicines, I don't think I did.
Okay. Thanks for that, Eva. Appreciate that. Thank you. Eva, so the question I want to ask you is, what actually happened?
I'm not really sure I have much more to add that the two gentlemen here haven't already mentioned, actually.
Okay, but we'd like to hear it from your perspective.
Okay, well, I suppose what was different for me in what actually happened was that my expectations weren't really met. There wasn't enough detail in the letter.
Okay.
And also she wasn't accompanied to the emergency department, so, you know,
well, those are
a shame.
very important points. Is there anything else you'd like to say about that?
I think that's probably about it from my perspective, actually. Yeah.
Right. Okay. Eva, so we're talking about item 3. Why was there a difference?
I mean, it was obviously a communication breakdown here, and I just feel so responsible for that. I mean, this, from my point of view, this was my fault. I can recognize that now. I mean, I should have included that information about her allergy in the handover, and I didn't. It could have been so much worse. I feel so responsible, and that has never happened to me before, so I'm actually quite worried about why that even happened. I don't know what else to say about that.
I can understand that you're upset, Eva. Everybody comes to work with the best of intentions to do the best they can for their patients. All we're doing today is to find out what happened and to learn from that, okay? Are you okay to continue?
Yeah.
Thank you very much for sharing this with us. It's really appreciated, and I know it'll be helpful for other people going forward. Thanks.
Had the handover been done correctly and we'd been given the proper information about the allergy that the patient had to anti-inflammatories,
we've been through this
we
already.
wouldn't have caused an extra discomfort to the patient.
Please, everybody, I'm sorry, Eva.
I'm sorry, but this is a really important issue.
Yes,
I
It's
understand
very
it's important, but you
issue.
have to let other people speak, Matt.
Okay, please let me speak now. James, please, could you put the phone away? We did agree at the beginning that mobile phones were to be turned off. Can you turn it off and then put it away? Thanks, I appreciate that. At the beginning of this AAR, we agreed certain ground rules, and it was to do with respecting each other, not cutting across each other, allowing everybody to speak. Can we regroup and agree those ground rules again? Because otherwise, I'm just going to have to stop the AAR. And then we'll have lost the opportunity to find out what happened with Angela's care and to learn from that. So before we go any further, can I just ask you to agree to the ground rules? You remember what they were. No mobile phones, James, thank you. Not interrupting each other, having respect for each other's perspective.